I understand and consent that the following information will be gathered and utilized for educational purposes by Indiana and Wesleyan students. I allow this information gathered and assessment to be videotaped and posted on YouTube for access by facility at the Indiana Wesleyan University. This video will be deleted by the student as soon as it has been reviewed and graded. Further acknowledgement that this is for educational purposes only, and the information is not meant to be a diagnosis. Therefore, Indiana Wesleyan University, the facility staff, as well as the student, are not considered liable.
Okay, so today I'm going to do a physical assessment. I'm head to toe. I'm going to start on your face and your scalp, and I'm going to work my way down, okay?
Sounds great.
All right. So the first thing I'm going to do is I'm going to palpate your scalp. And I'm checking for any lesions or indentations back in your occipital area. Looking for hair distribution. Scalp looks dry, normal, no dryness or flaking. Then I'm going to palpate your sinuses. Tell me if you have any pain at the pressure there. No pain?
No pain.
Any pain there?
Mm-hmm.
Okay. Then I'm going to look at your eyes. Let me get my light. And I want you to look straight ahead at me, and then I'm going to shine the light over here for your pupil reaction. All right, and then I'm going to check for accommodation. So look at my finger, and you have your pupils are reactive and accommodate. And then I'm going to check for your conjunctiva. Just going to pull your lids down. And then I'm looking at your eyelashes and their distributions, even and normal. I'm going to check your temporal or pulse. That's good. And your TMJ. Can you open your mouth? Any tenderness? Close it. Open again. Close it. Good. And then do you have even sensation?
Mm-hmm.
All right. Then I want you to close one side of your nose.
Okay.
I want you to close your eyes.
Okay.
And then I want you to breathe in and tell me if you can smell this. And what is it?
Coffee
All
smells
right. And then the other side. Can you smell that side?
I can.
All right, good. All right, then I want you to smile for me. Okay. And then I want you to puff out your cheeks. All right. That's good. And then I'm going to look into your nose and make sure that there's no obstructions or nodules. Okay. And then I'm going to check for the evenness and the symmetry of your ears. Do you have any pain if I pull down? Okay. And I'm just going to look in. Everything's clear, no drainage. And then I'll look on this side, no drainage. And then I want you to open up your mouth. Say ah, and swallow for me. Okay. And I'll open one more time. Let me look at the mucous membranes and the good dentition. Next, I'm going to feel your lymph nodes behind your ears, following down your sternomastoid muscle, underneath your mandibular, and then your chin area. And then I'm going to feel down into your... I don't. Okay, that's okay. And then I'm going to feel in your clavicle area here. Everything feels normal. And then I'm going to feel your carotid pulse. Okay. That's normal. All right. Then I'm going to examine your lungs. First, I'm going to palpate in between your intercostal spaces. Do you have any tenderness?
I don't.
Okay. And then I want you to repeat the words, your space, 99.
99.
99.
99. 99.
Okay.
99.
Perfect. And what I'm checking for is tactile fremitus. Let me do the back here.
99, 99, 99, 99, 99, 99.
Okay, tenderness. And come here, kitty. All right, now I'm going to listen. First, I'm going to listen over your arteries with the bell of my stethoscope. And I'm listening for any bruise. Everything sounds good. And I'm just going to listen for your lung sounds. Big breath. Good. Big breath. Good. Now I'm going to listen under here. All right, and then I'm going to listen to your back area. Big breath. Okay, good, thanks. Okay, now I'm just going to look at your arms and your joints. Do you have any tenderness in your joints? All right, and your wrist? Do you have any tenderness?
No.
Okay. And how about any of your joints?
No.
All right. Check this one out. And there's no lesions. Skin is smooth in texture, not dry. Good capillary fill. No clubbing at the fingernails. Does this hurt if you bend it down?
No.
Okay. Alrighty. And if you can just lay back for me. And if I can just can I pull your shirt up just so I can see your belly? Okay. All right, the first thing I'm going to do is I'm going to look for any abnormalities. The skin is smooth. I don't see any bulging, any hernias, anything that would indicate any ascites. Then I'm going to auscultate, starting in the right upper quadrant. I'm listening for vowel sounds. And I'm going to listen for your aorta. Listening for any bruits over the area on your left and right renal artery. Iliac. And your femoral artery. And I'm going to palpate gently first. You tell me if there's any tenderness. You feel any tenderness?
No.
Okay. And I'm going to just take my fingers and kind of curl up under your rib here. Take a deep breath. Okay, let it out. All right, and we'll palpate over here. Okay. All right. And I'm going to have you lift up your leg. And tell me if you feel any pain in your lower abdomen.
No.
Okay. And then lift up the side. Any pain in your lower abdomen?
No.
All right. And then what I want you to do is I'm going to go ahead and check for your hip or joint, any joint movement. So what I'm going to do is I'm going to raise your leg up and I'm going to push out. I want you to push against me. Okay, push it. There you go. Good. Now push in. Good. All right. And then let's do the other side. All right. Good. And that's checking for the mobility in your hips. As we move on down, I'm going to look at your legs. All the skin is smooth. It's consistent with your ethnicity. There's no bruising or lesions. We'd like you to flex your ankle. Good. And then back down. And then to the inside. Good. And then outside. Good. And then do the same with this leg. Just fix that. Good. Down. Inside. Out. Good. And do you have any tenderness in your knee?
No.
Right. How about this knee?
No.
All right. I'm just going to feel for your pulses. Your radial pulse. Good. And I have to feel for your brachial. That's good. And then on this side. All right. Now if I can just have you sit up. All right. Now we're going to stand up and I'm just going to do some. I'd like you to turn around. You know, I'm just going to check for your spine. Check for the curvature. Be concave here at C7 and then going down. So it should be convex going over your lumbar spine and then again convex going, your thoracic spine and then convex going over your lumbar spine. Then if you can just bend over, I'm just going to check for any scoliosis so that your hips are even. All right, you can stand up now. And then, okay, I'm going to check your cranial nerve 3, 4, and 6. And so I want you to look at my finger. And I want you to follow my finger here, up.
Just with my eyes.
Mm-hmm. And then back. All right. And then I want you to, I'm going to wiggle my fingers. I'm testing your peripheral vision. So I'm going to wiggle my fingers and you tell me when you can see them.
I can see them.
Okay. How about now?
Yep.
All right.
Yep.
Looks okay.
Yep.
Okay, good. All right. Then I'm going to, okay. So now I want you to close your eyes and see if you can hear this.
Yes.
All right. And then this side.
Yes.
Okay.
Now you're on.
Okay. I want to test your, strengthen your neck muscles. You're going to, it's more cranial nerve 5. So I want you to turn to the right, and then turn to the left, and then straight ahead. Now I want you to turn against my hand. All right, good. And then turn against my hand. Good. I want you to look up and look down. And then I want you to tip your head sideways, laterally, and then other side laterally. Good. All right, and then straight ahead. All right. Now I want you to shrug your shoulders. Good. All right, now I want you to shrug them against resistance. Okay, good. The next thing I want to do is it's a coordination exercise, so I want you to turn your hands palms up and then pat them down on your thighs and then over, and then do that repetitively as fast as you can. Okay, good. You can. All right, now I want you to close your eyes, and I want you to give me one of your palms. And then I'm going to trace a letter or a number into your hand, and you tell me if you can tell what it is.
B.
All right, and give me your other hand.
R.
Oh, that's not a very good. I didn't do a very good one. Let's do this one.
3.
Good. All right. Okay. All right. I'm gonna listen to your heart. So I'm gonna listen at S1, S2, Erb's Point, for your tricuspid valve. And then the apex. Okay, and then if you want to lay down, please, I'm sorry, we have Kitty. Wants me to assess her. All right, so first I would inspect for any pulsations, feel for any pulsations precordium to make sure that you're not having any fluid overload or any heart. All right, I just want you to walk towards, you can walk towards the door and just swing your arms, normal, and then we'll turn around and walk back. All right, you have a normal gait. And then I want you to stand on one foot. And then I want you to go ahead and stand on the other foot for balance and equilibrium. You have any questions or concerns or anything?
I don't, thank you.
Well, thank you for participating, and I appreciate your help.
All right.